What is seropositive Ra and how is it different? Imagine your immune system mistakenly attacking your own joints and sometimes other parts of your body. That's what happens in rheumatoid arthritis, a chronic inflammatory disease. Now, within rheumatoid arthritis, there are two main types, seropositive and seronegative. Today, we're focusing on seropositive rheumatoid arthritis. Seropositive rheumatoid arthritis is characterized by the presence of specific antibodies in the blood called anticyclic citrullinated peptides, or anti-CCPs, and rheumatoid factor, or RF. These antibodies are markers that help doctors identify this type of rheumatoid arthritis. If these antibodies are found in your blood, it indicates seropositive Ra. If they are not, then it's considered seronegative. People with seropositive Ra often experience symptoms similar to those with seronegative Ra. These include joint pain, stiffness, swelling, fatigue, and sometimes fever or loss of appetite. However, seropositive Ra tends to cause more than just joint issues. It can lead to extra-articular symptoms, which means problems outside the joints. For example, individuals might develop rheumatoid nodules, which are from lumps under the skin, or vasculitis, which is inflammation of blood vessels. Other organs like the lungs, eyes, skin, heart, and nerves can also be affected more often in seropositive cases. One important aspect of seropositive rheumatoid arthritis is that it can be more severe and progress faster than seronegative Ra. It often leads to joint damage and deformities more quickly. This is partly because of the presence of these antibodies, which are linked to increased inflammation and joint destruction. Additionally, there is a genetic component involved. Many people with seropositive Ra share a genetic marker called the shared epitope, which is associated with the production of anti-CCP antibodies. This genetic predisposition can make the disease more likely to develop and potentially more aggressive. The key difference between seropositive and seronegative rheumatoid arthritis is the presence or absence of these specific antibodies. Seropositive Ra has anti-CCPs or RF in the blood, while seronegative Ra does not. Because of this, seropositive Ra often shows more severe symptoms and a higher chance of developing extra-articular problems. It also tends to progress more rapidly, leading to joint damage sooner. Understanding these differences is crucial for proper diagnosis and management. If you suspect you have rheumatoid arthritis, it's important to see a healthcare professional who can perform blood tests to check for these antibodies. They can help determine the type of Ra and develop an appropriate treatment plan. Remember, every person's experience with rheumatoid arthritis is unique, so personalized medical advice is essential. Always consult your doctor for guidance tailored to your specific situation.